Hey guys, today I have Dr. Ben Peery, who is an emergency medical doctor in Glenwood Springs, Colorado, right in the dead center of a bunch of the over-the-counter elk units that a lot of you guys are hunting. And he knows the injuries, the accidents, all the bad stuff that can happen up there in those wilderness areas. He sees it. He's the guy that honestly, in the middle of your hunt, you don't want to see, but he's got the actual experience that matters. This isn't just speculation. It's not me talking about the 4 or 5 scenarios that I've had to deal with accidents and rescues up in the woods. He has actually seen the overall data set. So we talk about the actual things that you need to be prepared for, the type of thing that's going to help you save a family member or a friend that you're hunting with that really matters. And we also go into what you actually need to have on your person at all times. The use of tourniquets, the use of gauze for stuffing wounds, all of that good stuff. This is the blocking and tackling, but narrowed down to what you actually need to do to save somebody's life. Let's dive right into it. All right, guys, on July 24th, I'm going to do a live Q&A. So if you've been dying to get me to answer your specific question, this is your chance. It's going to be here on YouTube. All of the details are going to be at pursuitwithcliff.com/Kafaru. You can sign up there. You can submit questions. You can also sign up for the giveaway that I'm going to do on that live stream. I'm going to give away over $1,000 worth of Kafaru gear in addition to one of my custom knives and one of my sharpeners. So go check it out. pursuitwithcliff.com/Kafaru. All right, Ben, great to have you, man. As you probably have seen in my content, I touch on the subject of like backcountry medicine, let's call it, dealing with emergencies, that sort of thing. But I have yet to have somebody that has like extensive experience dealing with those scenarios. So I am happy to have you on, man, to dig into that and then also provide people with some value around the topic. I feel like there's a lot of anecdotal stuff. There's guys like me who talk about it a lot, and really in the end, we've only dealt with, maybe 3, maybe 5 different scenarios that were across the spectrum of really how intense they were, and I guess the information is, I always wonder when I talk about it if it's any good. So I'm looking forward to digging into it. Do you mind just giving the audience just a little bit of your background?
Yeah, of course. I'm an emergency room physician. I live up in Glenwood Springs, as you and I were just discussing. I moved up here in 2006. I did all my training at a big Denver trauma center at Denver Health, and after going to school at University of Colorado, I was born in Gunnison. I've been in the mountains my whole life, with a small interlude where we lived in New England and in Nantucket, and my dad actually had a commercial fishing business for bluefin tuna. We would catch them with rod and reels, and I've been on the water a lot, and was fortunate enough to get here in these stunning mountains. And it's a busy ER here. I've been involved in all kinds of stuff here. I was on the SWAT team here for 4 years. I was medical director for different agencies like Glenwood Fire, Basalt Fire, and just have had a wide range of really interesting experiences because we get so much interesting degrees of trauma and injury being in this area. We get tourists, we get people falling off horses, ATVs, we get crazy rescues from the backcountry, which I can dive into a little bit. It's all manner of things, including all the medical emergencies. And I just, I've been bow hunting my whole life, chasing elk, mostly unsuccessfully, as probably most elk hunters would admit. But I'm always amazed at what the possibilities for injury are out there, and sometimes it really does happen. And I've never. I think there's a myriad of information I think people should know. At least trying to keep it as simple as possible, not to get overwhelmed. Because if you open up like a wilderness, medical kit they sell on at REI, there's a lot of stuff in there that you're like, what do I do with all that? So I'll
Yeah.
try to break down some simple things that might be helpful for most folks. And as a guide, you've spent your life in the backcountry. You must have seen some interesting, pretty scary injuries at times too. So
Yeah, I have, but what's crazy is what you just said is I've gone through this progression of first aid stuff, right? And I think everybody does it. You want to be prepared for every situation, and then maybe over the years you start to look at all this gear you're carrying around and you're like, I either don't know how to use this or the actual scenario that I would use it in is probably not going to, it might make somebody a little more comfortable, but it's not necessarily going to like save a life or anything like that. And then over time, just because weight is weight in the backcountry, you tend to start to thin everything down. So I would love to just start there, Ben. Not to jump to the end,
Yeah.
but I know my audience, like they're gonna be curious. What should a guy be carrying? Do you mind
Yeah,
like just
that's
diving into that?
not at all. Not at all. As my colleagues and I talked about this for the last week, we're just, chasing, kind of getting everyone's sense of what would be best. And, for me, a lot of things that I would recommend carrying are dual purpose. For example, like a Swiss Army knife, right? With a pair of scissors, because the Swiss Army knife scissors is super precise. Like it can be used for cutting suture. It can be used for a lot of things. So it's dual purpose. There's nice little blade in there is helpful. There's little things. So as far as a general all around tool, I mean, I'm sure people have their favorites, Leatherman and different things, but that's an easy one to throw in.
Sure.
We use some form of tape, and if we use some really cool stuff in the ER. That's made by 3M that you can actually that's kind of sticks to itself. But duct tape and electrical tape is bomb proof, as everybody knows. So I recommend people throw some sort of gauze that's probably non-adhesive, that's not going to stick to a wound, something to tape it with. Um, there's some debate about clotting. There's clotting bandages can be helpful for someone who's really bleeding out. You can stuff it in a hole. And I'll tell a story about somebody who needed something like that recently on an archery hunt. But some way to provide a clotting medium for that to happen. The small tampons, believe it or not, are super helpful. Some A lot of folks are on blood thinners, more folks than ever because of atrial fibrillation, and those blood thinners can cause a nosebleed to come let loose in a very dramatic way. We've seen some unbelievable nosebleeds in our time, and the easiest way to stop it is to stick something up there that completely fills that space. So a small tampon jammed in both nostrils can really be helpful. And I'll talk about just a very brief primer on how to stop a nosebleed because I see it in all different forms. You need some way to keep people warm, so a little light blanket. A lot of us carry that backcountry stuff, but those emergency blankets are great. And some sort of gloves to protect your hands. Obviously it's in most people's kill kits, so you don't have to double up.
Sure.
I love a good ace wrap is so valuable because it can cover a lot of terrain. You can wrap it around a chest, you can wrap it around in a wound in the belly. You can help secure a knee, an injured joint. I don't know, blisters wipe people out, right? Your clients
Yeah,
probably deal
sure.
with that all the time. So
Yep.
Band-Aids, blister care. There's some debate about whether some sort of steri strips to close a wound. We, you're, it's the truth of it is with most wounds, even the big lacerations that are going to need to be stitched, you don't need to stitch them or close them right away. In fact, the tighter you close them out in the backcountry, the more likely it's going to get infected. But you could throw some steri strips or band-aids or even cut some strips of electrical tape to close that wound, get it. And you have 96 hours to get back and let us do a delayed closure on it,
Right.
back in civilization. Wound glues are very helpful for lots of things, small blisters, even, tears in the skin. And then, the question of meds is always like the basics are something to stop vomiting. You can get it from your doctor called Zofran. Even a general antibiotic is not going to hurt if you think you have an infection. It's easy to start, like Keflex, loperamide or Imodium for diarrhea, and then your own meds. You got to bring your own stuff, and you can't be
Right.
dependent on somebody else. So, some way to purify water, but that's again part of most people's just general equipment. So,
Yeah, just like
pretty
the
simple.
emergency kit.
Yeah, the one that we've seen a lot of use on lately, man, in the last year, I've seen some spectacular saves with tourniquets here in
Okay,
Glenwood.
I was gonna go down that path with you
Hundred
because
percent, 100%. It's hard to make a backcountry tourniquet that works as effectively as those cat tourniquets that they sell by the dozen on Amazon. So that's something you should have in your truck. Like we've had some cases recently. One guy got his arm completely. This poor kid got his arm completely cut off on I-70 last summer, and if it wasn't for a passing motorist with a tourniquet, he would have bled out right there and died. So it's something gear can go in any vehicle. You can travel with it in the winter. You can throw it in your backpack and for hunting or whatever. So this is kind of an all-purpose go bag for most medical emergencies.
right.
But I would 100% recommend throwing a tourniquet in there.
And I've heard this discussed a little bit. Do you think should people have one or two of them? Does it matter?
Good question. I think if you're going to carry one, carry two. And the logic is, and we've seen this as well, uh, the first tourniquet for whatever reason isn't tight enough, or if you don't, sometimes what happens is the vessel retracts. So if you have a, like, not to gross people out, but if you have a stump of an arm or stump of an appendage or something that's really badly injured, a rock slides down over your hand, it's completely mangled and you're bleeding out. Sometimes those vessels will retract up into the tissue. So you put the tourniquet down too low. So the question is always like, get it as high as you can, as far up the vessel as you up the injured extremity as you can. Tighten it down. If you're still trickling a little bit, put on a second tourniquet, and usually the second one will take care of it. We've seen lots of double tourniquet going on, and it works great. And we're very happy that people had two. So I would do two.
Yeah, and it's a pretty low. I mean, I've never put one on a human before. Outside
Yeah.
of obviously like very loosely, that sort of thing. I hear some interesting thing. I've heard several times that they really hurt people, and like
Yeah.
it can almost be like stunning when you put one on. Outside of that, though, I'd love for you to comment. Is tourniquets? If I just watch YouTube videos on it and then I carry it, am I like a competent user of them, or do I need some
Yes.
sort of train? Yeah, it is. So it's that simple.
Well, what we do is, I'll tell you what's a really good exercise is to put one on yourself, because that's a possibility too, right? You're crossing a rock shale slope, something, you get a shearing injury, something's really bleeding, and your hunting buddy's half a mile away over a ridge. Practice putting it on yourself, and you'll instantly see the mechanics of how, because it tightens down like a belt, and then there's a little twisting device that just tightens the material, and it's got a little hook, and you spin it enough till it gets super hard, and then you just let the plastic bevel rest into the hook, and it holds it in place. But if you don't, so practice on yourself once or twice, and that's pretty much it.
Yeah. Okay. So it is as simple as it is.
Super
Cause
easy. Yeah.
yeah, and I carry one all the time, but it has struck me. I'm like, I wonder if I really am competent at using one of these. And I guess the follow on to that is like, yeah, that was a pretty, to me, like all that stuff made sense, Ben. But tons of this audience is going to be, I mean, you're familiar with elk hunting, and they're literally going to, a lot of them are going to be hunting, like you're in the center of it, right? You're in the center of a bunch of over the counter elk hunting
Right.
units that a lot of these guys are going to go to. And one thing about it is, guys are gonna want to carry less and less, like just as minimal as possible. If a guy has his inReach with him, he's got some communication, can probably get help within, let's say, like 12 hours or something like that, and almost anywhere he's backpack hunting in. It could he even narrow it down more? Could he just take like gauze and a tourniquet, or is it just like, what's your thoughts
Yeah.
on that?
Yeah. Gauze, a tourniquet, something for pain, um, and some, yeah, pretty much that would do it. The things that you can stay in the woods with, are so minor eye trauma, some mild GI distress. You can, throw a couple of tablets of Imodium in your pack, throw a couple of tablets of Zofran in your pack. Um, Most cuts, what we see a lot of people, probably seen this a lot too, when people cut themselves when they're cleaning elk, right, or cleaning game. And that's
Yeah.
what we see, a lot of stab wounds to the thighs, straddling an elk and trying to do something. So, but most of those are perfectly fine as long as you stop the initial bleeding, to just cover it and then get it dealt with when you get out of the backcountry. So you don't need a lot for that. You just, if you can wash the wound out and then dry it, put a little gauze over it and tape it down, you're good to go.
Right. So it'll work. Man, I would love to jump in. I know we traded a couple messages via email. Do you have some scenario? Just because you're in the center of it, do
Yeah,
you have any
yeah.
scenarios that are like
I
specifically hunters,
I
Ben?
got a real good one. So when I was in the ER, this was maybe 2 or 3 years ago, and you might have heard about this story, but in any case, I was managed some of it directly, so this is why it's relevant. But this is a couple of guys who were hunting in a unit really close to here, bow hunting, and basically the story was they were calling a bull. The bull was hanging up. It was getting dark. The caller moved ahead of the shooter, and to try to put a little pressure on the bull, but it was just clearly getting dark beyond shooting light. And he started to walk back down the trail, and unfortunately, and how these mistakes happen, and for whatever reason, his buddy shot him with a bow.
Oh,
with a
jeez.
compound bow through, kind of hit him below on the, I believe it was on the right side, but it didn't go into the viscera like this, the guts. It skimmed outside and through like the abdominal wall, but then it punched through his right butt cheek, his gluteus, and lodged in his backpack. So it was a not it was a fixed blade. Actually, I think it was a three blade, and it when it lodged in the gear in his backpack, it kind of pinned him against his pack. And these guys were probably at least 3 miles in the backcountry, and it was completely pitch dark. And I think what was really happening was they had seen a bear in the same stand of trees that they were in. And so that was the bear was in close proximity the whole time. So they were kind of panicking about that. But they basically had to decide what to do, which was number one, the mantra with penetrating trauma is if you can, if you have help from paramedics or whatever, leave the object in place, right? And that, so if it's like it's a branch, it's punched through. If you can leave it in, because once you pull that out and take that space filling device out of there, there's a lot of potential for bleeding.
Sure.
So in this case, the arrow had kind of tamponaded some of the wound, but they couldn't move him without, and he was able to actually probably get up on his feet. There was no way they were going to get him out, and so without either him walking or getting some help up to him, but buddy wasn't going to leave him laying there bleeding with a bear. So
Right.
they ended up unscrewing the broadhead in the pack, and then gently sliding the arrow out, um, and then patched it up as best they can. And this gets into that scenario where do you put in clotting material packed, because the clotting material comes in a big wide gauze, and you can actually stuff it into a hole, like a gunshot hole. You can put it in anything that's bleeding and just fill the space. Those guys ended up, I think, just using a piece of t-shirt, and the guy was able to limp out of there. But this is the interesting part. Despite people are like, what kind of person would shoot their buddy, which is not part of this discussion. But it was a mistake. The guy made it back to his truck, and he actually was able. So we watched him closely overnight in the ICU, and the next morning I was coming into work, and I heard this. We call it a code white when someone's hemorrhaging to death in a hospital. It's called a code white. So I ran upstairs to the ICU, and this guy was just getting ready to be discharged, and his wound just exploded. He had a gluteal artery that opened up, and nobody knew about, that was
Ooh.
away from the exit hole. And so we damn near lost him right there in the ICU, and we had to rush him back to surgery, and then they were able to cauterize the bleeder. But it was extremely hard to stop it. And I actually, just for the listeners, like for real injuries, I mean, I'm talking like gunshot or a stab wound, something that's really bleeding. I was up on his. I had both arms extended. He was on his belly, and we were putting pressure on his butt, trying to stop the bleeding, and it took like my full body weight just to slow it down. And that's not the first time that's happened with some of these wounds. So it was really dramatic. They're lucky it didn't happen out in the backcountry, because he would have hemorrhaged to death without some serious intervention. But um, it's rare we get those big penetrating injuries. Most of our stuff that we see is people falling off horses. I've had hunters break both wrists coming off, which is terrible scenario for that guy. Having to splint both wrists. I've had a woman who was up riding with her cattle the other day. She's 75 years old, pretty cool. But she came off the back of her horse and shattered her hip, and they were probably 6 miles back, and
Yeah.
trying to get her down and figure out sort of a carrying device. So anyway, it's most of what we see here are blunt injuries, so fractures, dislocations, things like that, and some exposure. Rarely we get the penetrating stuff, but that was an example of somebody who really could have had a serious, ended up being extremely serious, but he was lucky it didn't open up on him in the middle of the backcountry.
Right, and it's interesting because I could see how they're not that common, but you've got to be like being like having a little info and maybe a little gear, you can actually save somebody's life with them. It's interesting, Ben, because I had several penetrating injuries I dealt with on horses that were like egregious. Like
Wow.
sticks and stuff like going into them. and they were just like random stuff, stepping on a log and it cracks and hits them in the belly or whatever. And those are like on the life, because people will always, like, people who are interested in what I did up in those mountains not too far from you. A lot of them are curious about like the horse and mule packing and all of that,
Right.
and probably the most startling ones were penetrating things. Luckily, I had, like, my dad's a veterinarian. I kind of knew how to deal with those scenarios, but it can happen, and I can only imagine it on a human. And one thing about what you said, I think I'm always curious about, and I could say that when and we can get into some of the scenarios that I've dealt with. I would say that I have, like, I've done like I've done the wilderness first responder course back in the day and kept up on it, and I've done
Yeah.
tried to keep up on it, always doing the CPR stuff and all of that. But I would say that when I have been in, I guess, really just like minimal trauma type of situations, I tend to be more hesitant than anything,
Mm.
Ben. And
Hmm.
like what you described, for me as somebody who's not working in an ambulance, working in a hospital, it's good to know, like, if it's bleeding, like you're not gonna hurt them. Like,
No.
is that the right take? Is that the right
I
way to
love
look
that.
at
I
it?
love that take. And what I still, I'll give you just, we'll go from the minor to the major. So one of the things that I find people, this is almost like something that's passed down through everyone in this in the world. If you have a nosebleed, the hard part of your nose, you can't squeeze. That's bone. You can't compress that. So the squishy part of your nose is, if the bleeding vessels are literally right there. So if you take the squishy part and squeeze it down, that stops the bleeding. But what I see people is doing this, and they're holding the hard part, and their nose is just hosing out. So the same principles apply, which is that basically, if you have to put physical pressure on the bleeding vessel, no matter where it is. So if it's an arterial bleed in the wrist or the hand or the forearm, you've got to squeeze as hard as you can, as close to the injury as you can, and hopefully proximal, meaning closer to the body as opposed to away from the injury, because obviously that's where the bleeding the vessel is. So you can't squeeze hard enough. You squeeze hard enough to stop it. And to your point about tourniquets, I think people get yoked up with adrenaline and they overcrank those things. So if you're watching the bleeding and it slows down or stops, you can stop right there. You just got to hold
Okay.
and don't let go. Like, it sounds dumb, but people are like, "Oh, I stopped it," and they let go. Like, we pulled tourniquets off in the ER to see, and it's like, holy shit, get it back, get it back.
Oh,
Like,
yeah,
it's,
yeah. Like, it
oh
start
my
the blood is,
God.
yeah, yeah,
Yeah,
yeah,
yeah.
yeah.
It's like biblical. So, um, it's direct pressure to the bleeding vessel. Period. That's how it works.
Yeah. And you're probably not gonna push too light.
No,
Yeah,
no,
I
no,
got you.
not at all. And just strong enough to make it stop, and then hold pressure for. It's going to be a good 10-15 minutes, but don't even try checking, because as soon as you check, it's going to bleed, and there's going to be a clot that forms, that kind of thing. So you don't want to knock that off. So yeah, hard direct pressure is the secret.
Gotcha. Well, so what? So yeah. So we covered the penetrating one. What are there some other scenarios? Like, even the nosebleed component of it,
Hmm.
or things that I would say that are what I've run into, but they're not necessarily somebody's gonna die from them, but they seem brutally painful to people, like dealing with dislocations, like those sort of things. Are
Yeah.
there are there other ones that people should be prepared for, that maybe don't get talked about that much, that you see in the backcountry?
Yeah, I would say, it's interesting. The Well, let me just say a couple things. The most of these injuries are going to need, like, when we start getting into breaks and even bad ankle, with short of having a horse or a mule, how the heck are you going to get out of there? Like, I remember years ago we had a guy break his ankle on, there's a mountain bike system out in Fruta, and he was out on one of the benches and broke his ankle. So there's no way to get that guy down the extreme terrain of this mountain bike area to get him out. So you have to call a helicopter. There's just some of these scenarios just need somebody to come get you, and that's just the way it is. But um, the what we see is shoulder dislocations, bad knee injuries, and when then obviously the lower leg tends to take a lot of abuse, so fractures of the tibia and the fibula. Um, and it the best thing you can do is just try to immobilize that joint. So you can use two limbs using your duct tape or your electrical tape, and just try to put the leg in a relative position of comfort, and then just go ahead and put down your makeshift splint. It helps a lot. Once you immobilize that injured joint, people can start to actually contribute to getting themselves out of there as well. But if you let that fracture flop around, it's incredibly painful. Those bones are rolling against each other. With a double forearm fracture, like both bones in the forearm, if we can get somebody stabilized with a piece of plaster or fiberglass splint, their life immediately becomes, I mean, their pain is cut by 70%, then it's a dull ache, but it's the
Right.
movement of the joint that hurts so bad. Um, there's tricks for putting shoulders in. I won't go into great detail about it, only to say that people can actually put their own shoulders even on first time dislocations. It's so miserably painful. People lock up so tight that we actually massage the trapezius muscles and get them to sit upright into a position, and they slowly start to relax. And then putting a little gentle downward pressure, their arm will actually relocate on its own. But it takes time, and it takes them calming down and getting some ibuprofen into them. So there's ways to do that as well. But what we see most of the time, the bad injuries are, on the severity scale, we see head injuries. Those are bad. Any spinal fracture, any trauma to the blunt chest or blunt abdomen. Those need rides out of the backcountry, and that's why you mentioned it early on. Like, you need some form of communication. You need a swim buddy of some kind. You need somebody to start helping and working on your exfil. But the rest of it can be managed with some good immobilization, stopping any bleeding that's happening, and provide structural support for that injured limb, and then you can start working on getting out of there.
Right. And one in there that I've dealt with, I've dealt with kind of tangentially a couple times related to horse accidents. I think the last time that I had a helicopter come into the wilderness when I was operating as an outfitter, a gal, she fell off a horse going downhill, and it was like, I don't know, we were probably like 4 or 5 miles into the wilderness
Wow.
area in the flat tops, and they were very very nice people. But uh, I kind of had a feeling when she fell, Ben, that she had broken a rib or something. The way that she fell, and she was in a brutal. She was scared for one thing, and then also like night was coming, so it was kind of like a time sensitive thing that way.
Right.
But she was complaining about her back, and so I remember. I mean, I got we called search and rescue and stuff because she didn't want to move at all, and it's tricky. Even though I've been trained on like how to clear somebody's spine, those things to look kind of those procedures. I found it very difficult because what I have found is there's a tendency for people when they get hurt, and I know they're in a lot of pain, that even when they're in a remote setting, they think that help's a lot closer than it is. And it was very hard. Like in this case, I had my own thought, but I'm not a doctor. I'm not a paramedic. I had my own thought that, okay, if she's broken a rib, we can get her we can get her home. You know what I mean? She's just gonna have to like bear down, right? And so, but I'm also thinking to myself, like, she's complaining about her back and she doesn't want to move, right? So, but in my mind, having previous like experience with these sort of things, I knew that her and her husband thought that a helicopter was just going to come in and swoop her out, and I knew that there was no way a helicopter was going to be there for probably a couple hours, and then plus where we were at, I knew a helicopter couldn't get there. You know what I mean?
Yeah.
Um, and so it was a tricky scenario, and I'll continue with I'll tell you the whole story, and then you can kind of comment on like what the approach or what would have been more appropriate. Is I never even went through the process of like clearing her spine or anything like that, because when I reflect on it, I think really what it was is I was so concerned about like my personal liability in it.
Mm.
Like in my mind, I'm like, her back's hurt. I'm not gonna, you know, do the spine clearing thing and then say you're okay and then put her on a horse and turns out her back's broken and then
Right.
I've done something harmful to her, right? And that was a real thought in my mind. So what ended up happening is helicopter came in, tried to get her, they couldn't. And I know there's like different capabilities of the different types of helicopters, in the setups and the teams or whatever. But they were gonna have, basically they had to, the way it was is they could only land in a certain spot that was uphill, and it would have been easier for me to just take her downhill. So some guys from the search and rescue folks, they're fire guys that I actually knew, they came in and they brought in a backboard, which would have been, I mean, people don't realize, like, if you've never taken somebody out on a trail on a backboard, it's like it's
It's
brutal.
brutal.
I mean, for them and for the folks involved, But the paramedic came in, and then he was able to do what I kind of wish I would have done the whole back thing, convinced her that she was okay. And then now that his expertise was in there, we gave up on the helicopter. We got her back on the mule, and I basically walked her out. I stayed on foot and walked her out. And every step, man, she like, it was in pain.
Wow.
You know what I mean? It turned out she had several broken ribs, and she was really hurt. It wasn't like she wasn't hurt, but there was no like back risk in there. I guess, do you have any thoughts on that
Yeah.
scenario? And do you have it, like, how does somebody approach that who doesn't have, or maybe doesn't feel the confidence to say, like, your back's hurt or your back's not hurt, or should they even make a judgment like that?
Yeah, it's a really good point, and I actually underlined this when I was going to talk to you about it. I think the biggest mistake people make in the backcountry is when to move and when to stay, right? So like,
Sure.
and because exposure is going to kill you likely before the injury will, unless it's something that's really obvious that you're in real trouble, you're having a heart attack. But my point is, like, you can't bunker up on the side of a hill in the dark in the backcountry with an injured back. You have no way to, like, you can't protect the person, you can't keep them warm, you can't, it's not even a reasonable spot. So you have to kind of take your chances. Interestingly, when we look at backboards and cervical neck immobilizers and stuff, the truth is, man, they don't really work.
Guys, biltong, okay? I have been obsessed with this stuff for 3 or 4 years. Ever since I got on a keto, carnivore, paleo-esque type of diet, I've had a hard time finding healthy snacks. Biltong is a great option, particularly the slabs that have this fat on the side. That's where your energy is if you're a fat burner like me. Super simple ingredients in this, guys. Literally 1, 2, 3, 4, 5 ingredients. Pair that to your gas station jerky. A great snack in the backcountry or just day to day. Biltong Depot is a huge supporter of my content. Go to their website, biltongdepot.com. Use my code CliffGray, CLIFFGRAY at checkout for 10% off and to support this content. Thanks, guys.
Is that the body kind of protects itself from injury. Most people protect their own neck. I've had plenty of mountain bikers break their necks with unstable cervical fractures that ride their mountain bike 5 miles out of the backcountry. The truth of it is they're kind of protecting their own neck because it hurts so damn bad. So we tend to
Right.
bind those areas up. So you're not, unless you're hyper flexing somebody or just cranking their neck, you're not going to make
Sure.
it worse. And I find that most people get paralyzed with, they start yelling, "Don't move, don't move, don't move." And I'm like, wait, they're fine for the moment. Like, we had a horrific accident on Grand Avenue last summer. A woman got hit head on by some dude running from the police. And when I ran up to the car, I happened to be getting a coffee next door. She wasn't breathing and she was horribly injured. And the cop was yelling at me, "Don't move her, don't move her." And I was like, dude, you got to move her. She's not breathing. She's going to die. And so you have to
Sure.
top down. You got to, like, think about, like, airway, breathing, circulation, and the rest of it can be managed. And I think when it comes to neck and back, do your best. The patient will probably protect themselves. And if you have to move them off a side hill or you're in a dark, bad place, then you got to make that call, like those guys did with the Arrow and the Bear. They're like, this is a bad place for us, and he's not hemorrhaging at the
Sure.
moment. So I think moving to a place where, because even then, to your point, you need if you're going to get evacuated, you can't get evacuated off that side hill. They're not coming for you.
Right.
To that point, they may drop somebody down who might have a small oxygen container that may last 15 or 20 minutes. They're the search and rescue has certain capabilities, but you're in the sticks out there, and to getting yourself into a place where number one you can be cared for, and number two you can be evacuated from is really critical. If you need that. So to your point, I think you use your good common sense. You do the best you can. And if a patient has an obvious spine injury and they can't move their lower extremities, that's a different deal. But even
Yeah,
then,
yeah,
you
sure.
know, even then, you've got to get them. You can't let them just lay on the side of a hill or a rock cliff. You got to move. So
Right. Yeah, and it was and it's interesting because it was one of those scenarios. It was a summer trip, so we weren't prepared to stay at all. And again, I think it's sometimes when you're do trips that seem so mild when you go into them, but then things go awry. People have a tendency to not real like that night. Nobody had anything, and it wasn't like we were ill prepared. Like if you go, into the mountains and you're gonna go on a day fishing trip or something. People don't bring sleeping bags and a tent and stuff. That's just the reality, right?
right,
We could have kept her warm, but it would have been like a group effort. It would have been like a very big deal because you're still up in the mountains at high altitude. Like to stay in there would have been like a pretty rough situation. And it's very interesting to me when you get into those scenarios. And I think hunters maybe take that for granted a little bit, particularly guys that are like they're hunting from their truck or whatever, and they just assume that there's not all that much danger involved or whatever because they're just hunting from their truck. But it's almost worse because now you've gone out and you could hike 5-6 miles away, and you don't have what you would even if you were up there backpack hunting or something. You know what I mean? It's kind of easy. It's hard, at least from my perspective. Sometimes, getting myself into scenarios that are difficult are not necessarily like the super remote ones where I'm prepared for days.
yeah, no, that's a really
So
good
it's kind of
point.
interesting.
And I think I've got one of my ER nurse buddies that's spent a lot of time in the backcountry. He just has a small go bag, and it goes everywhere with him. Whenever it doesn't matter if he's going on a hike with his wife, they're going on a mountain bike trip.
Right.
He just goes in his back, and it's got enough to keep him alive and enough to take care of that stuff. So I'm the same way. I get lazy about it. I went for a hike up Snowmass yesterday, and we were up 3-4 miles away, and I thought, well, if I it's you don't think about it till it's too late, and that's sort of that's that whole preparedness thing. But it's
Yeah.
listen, and sometimes people just make good choices. And last do you remember maybe 10 years ago, I wouldn't say it was like 2011 or 12, it was a really big snow year, and we had early snows up on the flat tops. I don't know if you remember that,
Yeah.
but it was a bad year, and,
Yep.
and a lot of late season hunters got stranded up there. They left their trucks up there till spring, but it stranded these three
Yep.
three dudes, first time hunters, and they were it was like 3-4 feet of snow. And these guys decided, number one, they knew they weren't going to walk out. Number two, the only thing they knew they had capability to do was to start a fire and collect as much wood as they possibly could. And they walked around that fire all night and melted water with like a Pepsi bottle. And a helicopter went and got them the next day. But they'd walked all night long around this bonfire, and they were fine. I mean, it was a bad night for them,
Yeah. Sure.
but they didn't do anything. They just stayed where the next to the lifesaver, which is cool.
Yeah. Yeah.
You
Stuck
know,
to the like
yeah.
simple's best sometimes.
Yeah.
Yeah. For
Yeah, and they
those
didn't
sort
have
of
they didn't have like
scenarios.
super fancy survival gear. They were wearing, stuff they'd bought from Walmart. This is their first hunt ever, and they were so they it was I kind of they actually landed the
Right.
helicopter next to the hospital as a Black Hawk, and about and they walked in, and we were high fiving them like, good job, man. Like, like you
Yeah.
guys
Yeah.
made good
Sure.
choices. So pretty
Yeah,
cool.
I think you bring up a great point though, because it's like there can be this tendency to be too much in a hurry or trying to get yourself out of a situation like in a short in a compressed like temporal time frame that gets you into trouble. Like I've had a couple.
Yeah.
I always get this question from hunters like, "Hey, have you ever spent the night like unplanned?" And I have twice, and it was and both of them were on mountain goat
Oh,
hunts,
wow.
and we killed a goat. We'd go up somewhere where just continually like the goat hunting deal. You find goats, and then you find one that you make sure it's somewhere where you can recover it, and then as you get into the hunt, sometimes what you thought was very doable became very difficult, and then once you've packed up your packs with the meat and everything else, it becomes very scary
Mm,
to come out, due to the terrain. Um, and both the nights that I've stayed up on the mountain unplanned were due to that. And
wow.
I actually think they're pretty good decisions, just because it's like, okay, this was very scary getting here. And getting out in the dark with now 90-pound packs or 100-pound packs is how we could potentially die.
Yeah.
And what's
Yeah.
always struck, it's what I think the only reason I've made those decisions, really, Ben, is that over the years living in that area, I would read the stories about people dying on the bells
Mm,
or something like that, and it was always they were in a hurry, and they cut across like switchbacks on a trail coming out, and they ended up lost and or fall or and dead. You
totally.
know.
Yeah. As a matter of fact, the things that have saved people have been, number one, staying where they are if they can, and recognizing that help can will come to them much easier than the opposite. And I think it's a matter of like, I think you have to swallow your pride and recognize that it's okay to get help and to be in a place like, if you, with kids and stuff, you always tell them, like, if you get lost, just stop moving. That's what hurts rescue efforts, is they're
Sure.
trying to guess where you went, and and it's impossible. So just sit down, provide your, shelter, warmth, and some sort of water, and I think you can survive even a cold night in the backcountry. You'll be miserable, but it's unlikely you're going to freeze to death with most of the gear people are wearing. So, yeah, and a broken ankle 250 yards from the truck is a major problem. Like, if you're by
Yeah. Yeah.
yourself, it
Sure.
is no fucking joke. I mean,
Yeah.
try, what do you, everyone thinks they're going to MacGyver this. The truth is, you're going to be crawling or hopping on one leg up through blowdown timber because you jumped out of your truck to bugle over a basin, you tracked a bull, and you stepped into a hole and broke your ankle, and you're by yourself. um, I had a trauma surgeon years ago that was doing a lecture up in Aspen, and he's from St. Anthony's in Denver, and he said, people don't realize when they go off on these adventures, they're grand adventures, they're in these beautiful places, but to your point, you said it so well, help's not coming easily, right? So you have to
Right.
accept, it's number one, there's certain risk to it. It just has to be part of the deal. And number two, any rescue attempt is going to be really challenged. You have to, so being able to stay in
Sure.
place and survive until help gets there is actually more important than anything else.
Right. And another thing you said there is like spending a night out there unplanned. It's actually not that bad, and it makes for like kind of a hilarious story after the fact. I think people in their mind, I mean, obviously you got to be prepared. You got to be able to stay warm and that sort of thing. But most hunters now with modern gear, like particularly a couple of guys, like make a fire. You can get through a night, and it makes for honestly like a hilarious story in some
Right.
ways, and you're avoiding potential issues. But what's weird about it to me is the intense feeling if you get yourself in that situation to not just stop and just be like, we're gonna stay here. Some of the viewers listening to this, if you've never experienced it, I think it's easy to take it for granted, like how intense that need to get back to camp, to get back to your truck feels. Like it's an
That's
irrational
right.
feeling. I don't know if you can relate to that, Ben, or you get what I'm
100%.
talking about, but it's incredibly strong.
It's a really good point, Cliff. With your water experience, and I've had some people, when people drown, and you've probably seen this, but like a riptide or something is pulling them away from the beach, they'll kill
Yeah.
themselves trying to get across 10 yards of water, because the notion of going out to sea and letting this current release them and just let tread water out there is uncomprehensible. The desire to put their feet on land is so strong that they'll exhaust themselves. And it's the same exact thing you're describing. Like, I have to get back to camp, instead of saying, well, I can't see it. My headlamp's out. I don't know where I am. and just deciding to hunker down.
Right.
You're right. That is a really good point, and um, there's lots of examples of
Yeah.
that here.
The water ones are interesting because they're more acute because like the time frame's
Mm.
tighter. But you hear stories about guys. It seems like every year a guy'll die spearfishing, not hung up in anything, nothing. Just his buddies will say he just was holding on to his spear gun, like he could have just let go of his spear gun,
Just fighting
and
for
he would
that
have died.
fish, you mean, and like, yeah.
Yeah, yeah, but just like that, but just let the fish drag him to a depth that he couldn't. And it sounds so weird, but it's just like an irrational like decision making process. You have to have the ability to like stop for a second and be like, I'm not gonna do that. It's interesting, and I've had like close calls with it, Ben. Like I vividly remember one time I followed a elk hunter up that I was packing a bull out for, and he met me. He met me down on in a valley bottom on a main trail system, and I came in with horses just to pack his bull out. And as he was taking me up to where the bull was, he had tape in the trees,
Yellow tape.
like
Yeah.
pink, yeah, yeah, pink like surveyor's tape or whatever. And I kept watching it, and he was just going all over the place. And this is an area that I've hunted a ton. I knew it great. In general, I would never be lost. I'd never be lost in there. But the trail he took into this bull, it was like all around this rim rock, just going through all this thick stuff. He took me to the bull, and it was right at dark. And I remember I remember telling him he's exhausted. He'd been quartering this bull all by himself. I was like, I'm good. I'll load up the elk. I'll bring it back to the ranch. Pick it up when you come out with your buddies, and I'll hang it at our place. No big deal at all. And so he left. I packed the bull up. I felt completely fine. And then I started going downhill, and I had depended on that surveyor's tape.
Mm.
But the thing about it was when he went down, just being like a good guy and like a good steward, I guess, of the wilderness, he had pulled the tape out.
Oh.
He had, and it's these big ribbons of rimrock. You know what I mean? Like that you got to go down the trail you came up, or you're just going to be going back and forth. And what should have taken me 20 minutes, Ben, it took me like 4 hours in the dark leading those
Oh.
horses. And I would just go, just going up and down the rim, like looking for a spot through. I mean, it didn't matter if you had Onyx or what, it didn't matter. Like you had to be there to find the spot where you could get through. And so I was just going through there, and I can't tell you how many times during that thought process, I looked down at something. I'm like, oh, like I can, my mind's like, oh, I can do this. And then I had to like consciously think to myself, if I do that, one of these horses is going to end up falling on me. I'll be dead.
Yeah.
You know what I mean? But the urge is so quick because you get frantic. You get frantic to get out of there. Because you're in an unplanned
So
scenario.
I know,
You
and
know.
it's funny. You knew better, and yet, like you said, such a strong urge to get home. I'm with you, man. It's it's interesting. We
I think it kills a lot more people that we don't even know
well,
about.
I
Like
agree.
you think to yourself, like, why did they make
Yeah.
that choice?
Like, I think people get cliffed out up on the Maroon Bells, and then they decide they have to get
Yeah.
out of there, and that's when they die. If they'd have just stayed where they are till daylight and let someone come and help them, they could have, they would have gotten them out. But they decide to find a way down, and then that's it. So it's really interesting.
Yeah.
Yeah, the other thing I wanted to mention too, you just reminded me, is that people forget, like, I think where a lot of people get into trouble is driving into their hunting camps. Like, the flat tops is littered with wrecks all on Coffee Pot and all these,
Oh yeah.
these big mountain passes. But you add a couple inches of rain to that, or some inclement weather, a little snow, and it's so we see people rolling their vehicles down an incline, and then, I mean, and having those injuries that they didn't even anticipate. And so it's a little bit of that too, where you're like, oh, I'm in a truck, I'm totally safe, this road is fine, until it's not. And then you're gonna have, and then that brings in a whole
Yeah.
myriad of stuff.
That's interesting because you actually see the data set, so you don't you're going to see the hunters that actually get hurt in the field or lost in the field or whatever, or in just outdoor recreationists. But you also see the reality is that it's probably, I would imagine, a lot of stuff just comes off Highway 70
Oh
and
yeah, or
vehicle
people, like
wrecks.
I said,
you
people
know.
sliding around up there. Everything gets slick, and all of a sudden they're over the side of a country road that they didn't think much about. They're still 5 miles from their planned camping areas. So it's interesting. We see a lot of. I'll say this to the listeners too. Uh, the condition that you have before you go to elk camp, and this might, if this is your first elk camp and you're coming from the lower elevations, elevation makes everything worse. So if you have high blood pressure or a cardiac condition, and we sometimes will see people that have had a stent, cardiac stent, and their cardiologist is like, you're good to go, we checked you out in clinic, you've been doing your rehab. I'm going to tell you right now that elevation is a monster, and just be careful. It's something that we see more than we realize. Like the physiology of being over 10,000 feet with no oxygen and partial pressure of oxygen and atmospheric pressures and stuff is no joke. So just to remind hunters that um, you need to be in a position where you're, like I said, the condition that you arrive at may be exacerbated by the higher elevation. So take your time. Don't rush out to Colorado and then sprint up to 10,000 feet, expecting everything to be fine because you were cleared by a cardiologist. Stop in a lower elevation, hang out for a day. Take your time to acclimate to those places, because we've seen people have major issues from just punching up to elk camp at 12,000 feet, and then they're like, whoa.
Yeah, just
They've been training, they've been carrying a heavy pack around the park, at home, all that. Just be mindful. Take your time. This is, it's not a rush. Get some enough days on both ends to take care of yourself.
yeah. And the altitude deal, I want to dive into it a little bit more from your perspective, Ben. But I noticed it in my business. It wasn't always the guys that were. What I found is like the older guys, particularly if they'd been a couple times, they kind of knew how to work, like chill a little bit at first. But I had a lot of issues with guys that came out and they drove all night with their buddies or whatever. So maybe they were a little bit messed up anyways, in terms of just their, lack of sleep, I'm sure like hydration and all of those things. If you drive 30
Right.
hours, it gets all off. But then they're so excited to be there. They get to altitude and then they do a gigantic day, and then they get sick. Like that's kind of what I saw. And sometimes it was younger, guys that appeared to be in pretty good shape and prepared and that sort of thing. Um, but what are the altitude symptoms that you feel are like don't ignore?
Yeah. There's
Do you have some
two
thoughts on that?
two good ones. One is, if you're it's one thing to be short of breath at elevation, as all of us experience. Even for people that live in these areas, if you're going to feel a little more short of breath than usual with exertion. But if that shortness of breath persists and will not go away, people can develop high altitude pulmonary edema from elevations, even 9,500 and higher in feet of elevation. So shortness of breath is not getting better, or in fact getting worse. And is one. The other high altitude thing that we see a lot of is, or have seen in the past, probably not quite as much as the lung stuff, is cerebral edema. People complain of like splitting headaches from, and it's more than the usual headache. Even your headache sufferer, migraine, tension headaches, cluster headaches. This is more of like a unrelenting vice-like headache that will not let you go. Um, and if your alarm bells are going off, then my alarm bells go off. So I would tell you, like, if you're short of breath, you're short of breath. And it's one thing to be, like I said, short of breath from exertion, but you should be able to sit down, chill out, and recover. And if you're not recovering, I've seen people walk in. I worked in an ER in Summit County for a couple of years, just as another job, as in addition to the one I do here. We would see people come in. So normal oxygen saturation is 90%. They were coming in at 50% just from being in Breckenridge, hanging out.
Sure.
And just ignoring it. They're so excited to be there. They're hanging out with their friends. They go to the bar. They're having dinner, and then they come in and they're sick as anything. So the only beauty about high altitude sickness is generally, almost without exception, just getting down in elevation below about 8,500 feet, 8,000 feet takes care of it. So the fix is to get out of there and to don't ignore those two things.
Yeah. If you get those more like severe symptoms, it's like it's
Yeah.
not going to get better,
Nope.
right? So yeah. No, I hear you, and it is what it is. And unfortunately, I've been fortunate in some ways because I spent a lot of time living at altitude, but it's isn't it weird to me? Sure, there's like these certain variables that increase people's chances, Ben, but some people just are unlucky.
I
They're
agree.
just like they're people who get seasick, or that's they just you just happen to have that element to you, and you just get altitude sickness. It sucks,
Yeah.
you know.
Yeah, that's right. You're totally right. I've had people that are lifelong Colorado, mountain people that can get it from. I, there's a guy named Peter Hackett that lives up here. He's kind of the world's guru in altitude medicine, and has written the Bible about all that stuff. But he says it can strike anybody at any time, and he's right. I do think there's some predisposing factors. I think hydration's a monster. I think taking your time with that elevation jump. If don't go to Miami, fly to Denver, drive in a car and drive up to the top of the flat tops. You're gonna suffer. So and like you said, it's always people that drive all night. They're drinking Red Bull and coffee. They don't drink any water. They get up to elevation, and they have trouble.
Yeah,
So but it can totally affect anybody. So don't ignore the symptoms. That is absolutely true. Um, it's
yeah,
interesting because in that regard too, one thing I wanted to tell people is that we're talking about injuries to yourself, right? And the thing that you need to remember for people is that you might be the rescuer, and to you, the story you just told about the back injury, you might be the person that is required to do to fix a splint, put on a tourniquet, do CPR. So there are some, you mentioned this about some of the wilderness courses. There's some very good ones that are short. They're probably, the wilderness first responder course, or the or basic wilderness cares, 2 days. Even someone that just takes a simple CPR course, learning how to do good CPR, as morbid as it sounds, saves lives. It
sure,
and it so just taking some simple precautions when you look at your own kit, your own med kit, when you're getting ready to lay out everything for your elk hunt, look at what's in it and then think about it and how to use it. How would you use it on your partner? Is the person you're going to the backcountry, are they an asthmatic, diabetic, high blood pressure person? Maybe that's not the right person to be the part of your duo hunt. You just need to kind of know where the
right.
limitations are. The other big one too is like severe allergies. So some people forget their epinephrine pens, and then they instantly, that's one that can't be missed. So just kind of knowing your partner, knowing their limitations, knowing their strengths, knowing each other, and just having, talk about how are we going to get out if we have trouble. How do we manage notifying people that we're here? Is it a spot or an in reach or whatever? So thinking those things through, pre-gaming a little bit makes a big difference, and a little bit of training goes a long way. It doesn't have to be a major, you know 4-month course like an EMT course. It's just simple stuff.
Yeah, yeah. And is that like yeah? So what is it? There's the wilderness first aid.
Yep.
There's the wilderness first responders. A little more extensive. I think that was like a 7 or 8 day thing or whatever. But those two kind of known courses. Is there any other like are like I like the Stop the Bleed
Yeah.
program? Those sort
Yeah.
of things, Ben. Are those you think those are applicable for people?
Well, what I like about Stop the Bleed is that it's again, you can YouTube it, but what it does is it forces you to take the tourniquet out of the package, open it like we talked about it, put it on yourself first thing. And then the
Yeah.
concept of Stop the Bleed is basically put direct pressure on a wound if there's a hole. And this was, morbidly, it was designed for mass shootings, and people that were responding at the scene of a shooting. If there's a hole from a gunshot, stuff a bunch of this clotting material in there as best you can, put a tourniquet on, and start getting the person to safety. And I just want to remind people
Right.
too, like, most of these injuries will be okay in the backcountry. They're going to be miserable for a while, but you got to get your the definitive care is getting out of there. And so um unless it's minor, so it's, yeah, that those are the things you need to think about in advance. Like, it's great that guys motor in 10 miles on foot, with their lightweight gear and their bivy hunting and all that. But remember, someone is going to have to figure out where you are and how to get you out, and you just need to have those simple things in mind. And it might be some guys on horseback, but transporting a wounded person on horseback isn't easy. That's not like a fix.
No. Yeah.
So
Yeah.
um
But it's I think you're bringing up a really good point Ben, because I really realized this over the times of having to deal with it. Just over whatever you just. It's not like it happens every day, but you get a few instances of it. I'm sure you've seen a ton of them. You start to look at the world within that spectrum. Like when I'm in the wilderness, I got where I would think about like, okay, like where are my neighbors' hunting camps? Where are like
Mm.
local guys? Like I know where they're camped. Like I would think about that from the perspective of like it's good to know like where I could get help. I used to even know I knew in the few drainages that I was in the flat tops, I knew where a helicopter could land.
Oh, that's cool.
Like I specifically would I knew just as I went through things, I kind of always had it in the back of my mind, and I guess it might sound a little bit paranoid to viewers, but if you go through a scenario and you don't know all of that, it's insane. Like I had a couple instances, including the one that I mentioned to you about the gal that fell, where I thank God they weren't injuries that somebody was going to die within 2 hours from, because I was not prepared to communicate with like search and rescue people at the level that I could have got it done in that period of time. You know what I
Yeah.
mean? And I think afterwards I got better because I was more conscientious of like, hey, how would you get out of here? How would you find help? How would do these sort of things? People don't think about it enough until it happens, and then it's a bit of it's a bit of like you're not just gonna call and be like, hey, here's the coordinates. That's not really how it works.
No,
You know what I
that's right. I
mean?
mean, I'll give you a tiny example. Like, I was racing in a mountain bike race in Leadville. The Leadville, it's a 100-mile mountain bike race, very popular.
Sure,
But I was about 25 miles into it, 30 miles into it, and I came around the corner. There's a guy laying in the trail, not unconscious and breathing. He was completely out, had a bad brain injury. And from that moment, I stopped. Another fire chief from like Tahoe stopped, and another person, and it took us 4 hours to get that guy. You would think at that event that there would be all kinds of capability.
right,
Search and rescue brought up a woman with a small oxygen tank on a four-wheeler, and what do you do with that, right? It doesn't transport anybody. You can't load anyone onto a backboard. He could have had any number of injuries to his spine, because we can't really interview him because he's unconscious. He's breathing on
sure,
his own, but he needs oxygen because we're at 11,000 feet. And by the time we walked him up the hill, they landed a helicopter about three-quarters of a mile away. So we finally got a backboard up to us. And to your point, I've never done anything harder than carrying a human being who's unconscious on a backboard in the backcountry.
yeah,
Like, it was insane. And by the time we got him up to the helicopter skids, I actually intubated him on the helicopter skids. Um, and on this rock scree thing that these guys had enough stability to land the helicopter. And he wrote me a letter about a year later and said, I wish I had good news to tell you, like, thank you for helping me, but I've had this horrific brain injury. I was an attorney. I can't do my work anymore, because all that time he was laying there, he didn't have oxygen. He was getting an injury to his brain tissue,
sure.
and he never recovered. And so it's just one of those things, like, you have to think about it, and certainly there's an accepted risk. But I even thought, it never occurred to me that we wouldn't be able to get him out of there with. You think about the different four-wheeler versions and stuff, but most places are inaccessible, and so to your,
Yeah,
you
that's just
know,
it. Yeah,
so
yeah. It just is what it is, and I have to comment on the backboard thing because I think the backboard thing, the couple instances that I've dealt with it even when there's a trail, once there's a backboard involved, there's no longer a trail
yes.
because you can't walk on the trail.
No.
You know what I mean? So people are like, you're like, all of a sudden you're on the best trail ever, but now you have the weight of the person in the backboard. It's dark, and now you're not walking on the trail because or only half the guys can walk on the trail. Whatever, you
Right.
know what I mean? If maybe the listener can view that. That's what makes it difficult. Like it's really hard. Um, and the I guess output that I've dealt with from people on the backboard, I don't think it's much better for them.
No.
You know what I mean?
No.
I think it's if you can avoid it, you wanna avoid it. But But let's go over just in case we missed anything, because the way I look at it as an archery elk hunter, rifle hunter,
Mhm.
or whatever, the ways that I could save a hunting partner. You went over the penetrating wound.
Yeah.
Actually, Ben, do you mind describing exactly how a guy would do that?
Yeah.
All right, guys, in some of my content, you're gonna see that I've been using this chest holster from Invader Concepts. This is with my 10 millimeter. I also use it with my Glock 19 and even a PMR 30. I'm gonna do a bunch of content here in the next couple months on that around bear defense. It should be interesting. It looks a little awkward to have your gun under your bino harness, but if you test out all the different variations, it is the best and you have it on you all the time. I do have a discount code. It's CliffG and it's for 10% off. Go check them out. Let's say like a archery penetrating wound, even if it's not too complicated, like if a guy's shot, what can
Yeah.
like a layman do?
Yeah, so I would say let's take an example. Let's say it's we're hunting in bear country, or whatever. You have an accidental discharge of a weapon, in and a guy gets a gunshot wound to the extremity. Like let's say it's the leg, lower leg, which is high risk of bleeding. Um, so number one, the person's going to go into shock if they're not already in shock. And what that means is your body basically tells all the blood in the periphery to go to the central core. And that includes the brain, because the brain does just fine without blood for a bit. It sounds crazy to say that, but the heart needs
Sure.
continuous blood supply, period. It's non negotiable. So people are going to pass out. So you got to lay that person down. And people, we see people like walking around with this injury. They walk into the ER with these injuries. We get them flat and we get them uncovered as best we can, because we're trying to look for other holes. So the example I gave, let's just assume that it's one injury, and it's moderately bleeding. We joke about
Right.
audible bleeding. Like if you can hear it hitting the ground, that's a lot of blood. But so let's
Yeah.
say it's moderate bleeding. Get the person laying down. Um, the very if you're by yourself with your partner, you can, to your point, you can grab the wound and hold it tight, and that person, your partner, is going to scream and yell and tell you to stop. But that is the quickest way to slow down bleeding. The second quickest way, and after you've got a little bit of control, if you hold tight pressure on that for a bit, you can work on getting your tourniquet out of either your partner's pack or your pack. And the person that had that injury can probably help you in that regard. Get the tourniquet out, put it as high up the leg as you can. If it's on the leg, for example, take that tourniquet and wrap it around as high up into the groin as you can. Tighten it down and tighten the spinner on it. You'll see it. It's got a little. It just wraps up the material as tighter and tighter, and then once you get control of that hemorrhage, you can let go. And even if you have to let go of it long enough to put the tourniquet on, that's totally fine. Um, at
Yeah.
that point, you can cover the wound. You can, if it's still oozing, you can try a second tourniquet. If you don't, you can try packing the wound. Even a piece of t-shirt or some material can be packed into the wound just to fill that space. Let's say that you stop.
Like when you pack a
Yeah,
wound, Ben. Not to get in the
yeah,
nitty gritty, but to me, like I've gone through this in my thought process. Do you need to like? Does it
yeah.
need to be like when you say a T-shirt? Does a guy need to cut it into thin enough strips where he can shove it
Yeah,
in
you
there?
could. You could take it, make it an inch long strip. If you're not going to be able to get your finger in there, it won't. You're not going to be able to get material in there either. You know what I mean? So I'm talking
Okay.
about a
Yeah.
real
Yeah.
wound, like what you described. My dog just got injured the other day walking through some deadfall, and a stick flipped up and stabbed him in the groin. Right? It was a small puncture
Yeah.
wound, but you can see where people would get all kinds of bad injury. It's a big enough hole. If it's a big enough hole to take material, cut a t-shirt or cut your whatever you're wearing shirt into small strips. Again, your Swiss Army knife comes handy. It's got those shears, right? Cut a couple of strips, take the material, and just like filling a toilet paper roll with gauze, just start filling it. And don't stop until it's
Yeah.
tightly filled, and then you can leave it alone. The person again is going to
Then you're
yell
done.
at you and
Okay.
curse your ancestors, but it's okay. Um, and at that point, once you've stopped the bleeding, then you need to manage the rest of the patient, which is he's laying there, he or she's laying there, they're in shock, their blood pressure is probably low. And then from there, the very next question is, we got to get you out of here, right? So start making those arrangements, get the person. People drop their temperatures right away. It doesn't take much, especially when they're in shock. So wrapping them with every bit of warm clothing that you can. If they're wet, You can consider trying to get the wet clothing off, but sometimes I think most of this stuff is made with wool and that's pretty good insulator. So I would leave them on, wrap them up as best you can, put an emergency blanket over them, make sure they're comfortable enough to not move around a ton. They can start drinking a little water if they're not nauseated. And then the next move is to start arranging some sort of transport or help out of the backcountry. And that's kind
Yeah.
of,
No,
yeah,
that
yeah.
yeah, that all makes a ton of sense. Are there any other ones that we haven't really talked about that
Yeah.
you've seen, Ben, that guys
The
should
other
be?
one you need to think about is head injuries. And we see a lot of sports related or backcountry related concussions. Um, the person that hits their head, falls off the horse, knocks themselves out. And this happens a lot. I mean, this is the rodeo world, the back, the horse world. Guys fall off horses, knock themselves out. What do you do with that, right? Is this a serious head injury, a serious head bleed? And the person that wakes up that is has a headache but isn't repeating themselves over and over, or initially they have loss of memory of the event, they don't remember the fall, but that initial exam, whatever neurologic exam you're seeing your friend going through, it should improve slowly. Um, but any persistent stuff where they just won't stop asking the same question over and over, they have a severe headache, they won't stop vomiting, those are the alarm factors for a head injury where you need to consider getting them out of there because they could have a brain bleed. I'll tell you, most people aren't going to have a brain bleed, but we are seeing so many people on blood thinners, and including dudes my age. I'm 55. Um, People start to develop these heart arrhythmias and they're put on these blood thinners, and so head injuries mean more. So again, that's another plan for the backcountry, like know your partner, know who you're going to woods with. So it does raise the risk, but generally most injuries to the head that require medical attention or evacuation are the ones where the neurologic exam is either getting worse or it's not improving. So you're going to have a headache with a concussion. You're going to feel nauseated with a concussion. You're just going to not feel yourself. But severe headache, once a neurologic exam is not improving, they're constantly repeating themselves, or they're completely delirious, or their headache is getting worse. They need to. That's an emergency. It needs to come out.
Yeah. What about
Oh
heart
man,
attacks,
that's
Ben?
a tough one because yeah, chest pain's a monster because you can't do anything about it in the backcountry except um, resuscitate them if they. Some people, why everyone trains in these communities for CPR and defibrillation is because of people go into a lethal arrhythmia called ventricular fibrillation. And if you can actually do good CPR and shock them out of it, they'll survive just fine. So now they make these portable defibrillators that are about this big. So outfitters and emergency folks that are taking clients in the backcountry, you can carry it with you. It's battery powered. It's easy, but that just requires good
Sure.
CPR and that and defibrillation. But that's one of those things where that's more preparedness and not biting off more than they can chew. This shouldn't be their first stress test of their heart. You know what I mean? Like you doing a
Yeah,
1,500-foot
sure.
monster hike to go up to get a goat shouldn't be the first time that they've run themselves that hard. So that's a tough one, Cliff.
Right.
And that's happened. People, we get people having heart attacks on the
Oh
river,
yeah.
and their guys are doing CPR for 4 or 5 hours. Sometimes yeah, so that's one that I don't think anyone can do much about except do good CPR as long as you can. If if the person is looks like they're gonna come out of it, you can stop, and if they're awake and talking to you, and miraculously you've been able to improve their blood flow, they still need to come out of there, but it's that's probably all you can do. We talked about, my colleagues and I were talking about aspirin today. Like, is it the worst thing in the world now? Not necessarily. You could give someone a dose of aspirin, just a couple of baby aspirin, and start making calls.
But the ability, tell me your opinion on this. Having the skill set of like knowing how to do chest compressions, that's way more valuable than having a
It's
bottle
way
of
more
baby
valuable
aspirin.
in any aspect of your life. I mean,
Yeah.
you might end up doing CPR in the hotel lobby. You never know. And I'll tell you an example. Like Kings County outside of Seattle has the highest heart attack survival rate in the nation. It's somewhere in the 40 percentile range because everybody in Kings County went and got CPR certified. I mean, it's like literally thousands and thousands of people. So if you have a heart
Yeah,
attack on the street, somebody's going to do good CPR, someone else is going to grab a defibrillator, and that's the treatment. So kind of
sure.
cool, right? So it's just
Yeah,
a bit.
yeah. But no, those are the coolest one. Those are the coolest ones because you're actually like, you're. I mean, somebody might have 30 years of
Totally.
life left, and if there's nobody there to save them, like, I mean, if you're a guide or you're somebody's hunting partner, and you just don't know how to. I mean, I don't know what you're feeling, Ben, but like I stay up on it. A lot of times I stay up on it with the online course because and it does
Yeah.
give me like a it gives me like a refresher, you know. I mean, I mean, you need to go do it because I mean, again, for me as
Yeah.
like a layman, Ben, like I don't think people realize like how hard you got to do, like
Yeah.
how there's a
No.
proper way to do it. But the fact that people walk around, just in life, let alone doing this kind of stuff, not knowing is kind of a bummer, you
Totally.
know.
Totally.
Yeah.
I'll tell the listeners too. One of the things that we do, we think about is the song "Row, Row, Row Your Boat." And if you start doing CPR, row, row, row your boat. That's 100 compressions a minute. It's faster than you think. It's harder than you think. And when let's say that there's two people there, and the person that's laying on the ground that needs CPR. You shouldn't be doing CPR for more than about a minute. You just switch off. You keep your arms straight. Don't let your elbows bend. So you're using your weight, not doing this. It's not a tricep workout. You'll wear out really quick. So it's a minute on, and person takes a rest. You jump on, and it's every minute switching off. Row, row, row your boat, and that's the cadence for doing good CPR. And you're pushing harder than you think, and you may break ribs. That's actually unfortunately the reality, and it generally indicates good CPR. Unfortunately, on older patients, their ribs are a little brittle, and that happens not infrequently. So,
Yeah. And this may be a weird question, Ben, but do you feel like you've saved somebody's life via
yes, oh,
CPR?
100%. Yeah. We've seen it in the hospital, like in the cafeteria. We've had dramatic saves by law enforcement here. I mean, this has happened more times in this community than I can tell you. Like early defibrillation, good CPR. We've had people walk out of the hospital completely neurologically intact, and they were 42 years old, dead as a doornail until that person saved their life. It's the coolest thing. I
Yeah.
agree with you.
That Yeah, yeah, no, it's totally is. And I know it's like an odd question, but like any in-person CPR class where there's been, real medical professionals and we're doing the CPR, I always ask them. And a lot of times, it seems like it's not that uncommon because, in ER rooms and stuff like you guys are going to do CPR on people. But it's interesting because I'm like sitting there asking people who I don't know about probably a moment that's like very significant in their life. But almost all of them say to me, they'll tell me the story and they'll be like, it was
Oh, yeah.
exhausting. Yeah, because it's like so much work, you know what I mean, to do it. So to your point, if you got to trade off,
One more thing, and I'll mention to people
but
too, is choking is something you can do, having a huge intervention on, and learning how to do the Heimlich is really important. You never know when your buddy's, choking down mountain house. It's not completely hydrated and starts to choke, and
sure,
being able to clear that is a monster thing too. So, and boy, those are 4 minute YouTube videos, and you can even practice getting with someone, even a bigger dude, and learning how to put the fist underneath the sternum and pulling upward. But that has saved people too. That's an amazing one.
yeah, sure, yeah, no, that's all good stuff, man. Well, we covered a ton, Ben. I feel like I need to get you on again to like talk about elk hunting and that part of your life and all of that, and then maybe some of the topics we talked
Yeah.
about beforehand too. But I feel like this in itself will leave people, um, just with like some more tactical stuff, which is very nice and and helpful for them going in the backcountry. But I gotta ask you before you go, because you yourself seem to be like a guy that's in good shape, and you're probably a little, maybe a few years older than me, same age or whatever. But do you have any recommendations on that front for preparation for these type of hunts or anything like that you think is good
Yeah,
for
I
good for
do.
folks?
I'll tell you, I've been working out for 30 years, 40 years, right? I mean, a long time. And what I've noticed is that, and this is just my personal take about a lot of the gurus and a lot of the Um, I think that no matter what you do, especially as you're getting to keep yourself safe, you got to simulate the work that you're going to do. So putting on a heavy pack and walking around with it is super important, and not just on the bike path, but like go uphill, get used to that moment, use walking sticks. I know, Cliff, you're a big walking stick guy. I totally agree with you. There's nothing
Yeah.
better. But this is a mind body spirit exercise. The reason we go into the backcountry, I think, for me, is a lot of there's a it heals me, both my soul and my spirit, and my mental health. So don't put do the work so that you can enjoy it. But there is a safety feature too, where your joints, your knees aren't going to blow out because you've developed enough hamstring strength, doing Bulgarian splits and Zercher squats or whatever you're going to do. But do the work in advance. Um, Learn to breathe through your nose. I know this is going to sound weird to people, but breathing through your nose while you're working out is a monster. It actually improves your cardiovascular fitness. It's like Cliff. It's a lot like spearfishing. Your whole is actually the same physiology. Is when you're holding your breath as you're breathing through your nose, you're actually training yourself to be more tolerant of CO2. And what ends up happening is you
Okay.
actually shift you improve your body's ability to deliver oxygen to your tissues. And so that's why people get fitter and fitter from spearfishing, because you're just get more efficient. So breathe through your nose, put some weight on your back, train yourself, and take good care of yourself. People ask me all the time about supplements. They're like, what about testosterone or creatine or all this stuff? Look, I'm a fan. I believe in that stuff, but I think sleep and not and improving just the general quality of your life is going to have moves the needle much more than any supplement ever will. So, start working on your sleep a month in advance of your trip out to your elk hunt. Like, track your sleep, pay attention to it, turn off your phone, read something at night. Make sure you have good sleep hygiene. Don't be lazy about it. Don't stare at YouTube till all hours in the morning. Stop drinking coffee after about 3 o'clock. Just do some simple things to make yourself. If you maximize your sleep before you come out for one of these trips, and just in general, the quality of your life will go up. So good sleep, good hydration, good nutrition, and taking good care of yourself. I think you'll be able to hunt for and get in the backcountry for years and years. Hopefully.
Right. Yeah, yeah. No, that's all good stuff. I gotta ask something on the nose breathing. Ben, when your heart rate gets up, do you never
No,
mouth
I
breathe?
think yeah,
Like
I know what you mean.
sorry, that's a weird question, but I think about these things and it's funny because I was up in the Collegiate Peaks this last week, doing some scouting with a guy, and he was in better shape than I am, and because now, well, one, he's just been on it more than me, but I don't live at
Mm.
altitude anymore, and I've always been one that breathes through my nose, but I was getting more out of breath, hitting out of breath, and then I'd recover pretty quick after a little break or whatever. But I noticed that I consciously go to mouth breathing when my heart rate goes up.
It
Does that
does,
does
and
that
I,
make
I
any
think the
sense?
reason is
Um,
is that what nose breathing does is it settles you. It people talk about zone 2 a lot. Zone 2 it's just a term that it's like what's your cardiac output. And so zone 2 is an area where you should be able to walk and or exercise and talk at the same time. You're a little uncomfortable with it, and I think that's what you're doing when you nose breathe, Cliff. You're maximizing your recovery. Your lungs, when you nose breathe, your lungs increase their capacity by 20% instantly. You actually expand all of your lungs, all of your lung tissue. Your cardiac output improves. Your blood vessels dilate in the extremity. You get used, and your oxygen dissociation curve with your hemoglobin starts to shift. So you deliver oxygen much more efficiently to the periphery. So there's a physiology to it. And so I almost say, look, don't nose breathe as much as you can, and don't push it beyond that. If you have to slow down your pace a little bit so you can stay nose breathing, do it.
yeah, I
That's the
gotcha.
secret.
Yeah, yeah, yeah. Like you use it as like is basically
Yeah,
like the
yeah,
speedometer.
yeah,
Like if you feel like you can't do it anymore, you're not benefit from opening your mouth and panting. You're better off just recovering at that point and
yeah.
staying with it. I see what you're saying. Um, no, that makes sense. I'll start doing that. But Ben, I appreciate all your information, man. Where can people follow you? What are
Yeah,
the
so
stuff you're working on?
I have a mental health podcast that I'll send the link to you. It's on Apple and Spotify, and we do a lot of work and discussion with um, mental health issues with first responders, frontline folks. I'm working for a small company called Envy Mind Health that developed an app that is specifically using biometrics like heart rate variability, sleep, movement to track mental health. And we were just having a lot of open discussions with folks that are super high performers like you, Cliff, that get out and get after it, and just trying to open up those discussions as much as possible. So if people want to take a listen to the podcast anytime, take a listen. I'm happy to answer any questions, and I'll send you my information. I'll post this list of like our just kind of the minimal gear, like the basics. I think people could pare that down just so they
Oh,
can put
sure.
together a little go bag. And then they can do that. I'm on Instagram as well. And I'll send you that info so you can post it in the show notes.
Yeah, no, perfect. I'll put it down so everybody has
Okay.
access to it. But thanks so much, Ben. I appreciate
Yeah,
it.
it
I
was great
appreciate your
talking to you,
time, man.
Cliff, and I appreciate your podcast. It's awesome. I really enjoy it. And yeah, good luck to the listeners out there. I hope it's a good hunting season and just enjoying the backcountry and being safe. And I say this with a total support and affection, but I hope I don't see you in the ER.
We're with you, man.
All right, brother. Have a good night.
Thanks, Ben. If you enjoyed this content, do me a huge favor. Subscribe on whatever platform you consume it on. Spotify, Apple, YouTube, whatever works for you guys. Everything else is on my website, pursuitwithcliff.com. Go there and it's going to be very apparent to you that I work my ass off just to not have a real job. All the hunts I guide, all the seminars I put on, all the unique experiences I offer, and the membership site, all the details are there.